So prostate cancer, that's a difficult one because there's a lot of controversy around screening for prostate cancer. Incidence about 1 in 15 lifetime risk for South African man. We know that you've got an increased risk if your father or a brother, a relative has prostate cancer, especially if in a younger age. And black men also seem to have a higher risk for prostate cancer. Now, years back when they started screening for prostate cancer, they used the PSA blood test. So it's a prostate-specific antigen. It's a blood test that you can do, but it's not specific for cancer. So it can go up with benign prostate hyperplasia, or it can go up if you've got prostatitis and things like that. So it's not specific for prostate cancer, but it does go up with prostate cancer sometimes.
Yeah. So, and it's late though. So let's build the layers again. So we're trying to build the layers for the Swiss cheese that the ball cannot fall on the ground. So the first layer is genetics. If your dad had it, or your dad's father, or your dad's brothers, you need to screen. Very much like breast cancer, there's a major genetic factor. That's our first. And then the second one is PSA.
Yes.
Also,
coming back to the family one, is if your brother had it, then you've got a higher risk than if your father had it. Just an interesting fact there. So then you need to definitely focus on that screening for the prostate cancer. So we're going to the PSA now.
Yeah. So on its own, a PSA is like flipping a coin. No, not even that. It's like a random number generator. So you just don't know. So just to bring what the PSA is. So the PSA, prostate specific antigen, it should be very high. The count should be very high in semen. It should be very low in blood. So if you find it in the blood and the level goes up, then it means there's been a structural change in the prostate.
Yes.
So it could be very late, but it is still one of the layers of a screening test.